A very good morning to one and all. On behalf of the Symbiosis International University, I welcome our panelists, dignitaries, and delegates to this Uni20 conference for university leaders from G20 countries for this session on transformative role of universities in promoting health and well-being. The expanded perspective of health refers to the need to monitor the subject beyond his or her physical body, understanding his or her health situation as resulting from social determinants that are articulated in a complex way. This is necessary for interdisciplinary and intersectoral policies and actions to provide better quality of life. Health promotion acts in a transversal way, ensuring the creation of healthy spaces and processes, generating social participation and commitment based on an active involvement in which the development of sustainable and equitable health actions is presented as complementary to the creation of public policies. To discuss the role of universities in promoting health and well-being, we have an esteemed panel right from Belgium to Boston and Canada to Australia. Joining us virtually is Professor Stephen van den Broek, Professor of Health Psychology, Department of Psychology, Faculty of Psychology and Educational Sciences, University Catholique, Belgium. And in person, we have Professor Dr. Olga Maslova, Northeastern University, Boston, Dr. Matt Dolph, Director, Office of Wellbeing Strategy, the University of British Columbia, Vancouver, Canada, Professor Anthony Whitty, Director, Centre of Education and Innovation, Australian Catholic University, Australia, and of course, our chair for this session, Dr. Rajiv Yeravdekar, Provost, Faculty of Medical and Health Sciences at the Symbiosis International University. I'd like to take this opportunity to introduce our chair for the day, a gold medal awardee at MD Obstetrics and Gynecology and topper of the Maharashtra Public Service Commission's examination, Dr. Rajiv was awarded a PhD under the Faculty of Management by Pune University. Dr. Rajiv was also invited by the Ministry of Health, Sultanate of Oman. A member of various governmental bodies, including the Medical Council of India, Central Supervisory Board, Maharashtra Medical Council, and professional organizations like FICCI and Nat Health, to name just a few, Dr. Rajiv is a member of the steering group of International Health Promoting Universities and Colleges, the working group of UGC to bring out policy on health promoting university, and the Fit India Movement Campaign Committee, Government of India. He has been nominated on the WHO project on development of Health and Wellness Assessment Index for higher educational institutions in India. Dr. Rajiv has also been nominated by the Honorable Governor of Maharashtra and Chancellor of the universities in the state as the Chancellor's nominee on the Senate of the Maharashtra University of Health Sciences. I invite Sir to give the opening remarks and take the session forward.
Welcome to this session on one of the session topics of the Uni20 conference, talking about the transformative role of universities in promoting health and well-being. It's customary normally to thank the panelists, whether it's Olga Maslova, Matt, or Professor Whitty, or the gentleman who joined us on Zoom, that Stefan van den Broek. I hope I've pronounced your name correctly, sir. But I would like to take this opportunity to thank you participants to having chosen to attend this panel discussion, because it is reflective of your commitment to your health and well-being, thereby the health and well-being of your family, and thereby the health and well-being of your entire community. As we all know, family is the basic unit of a community. And it is the best tribute to this session, the importance that an 88-year-old young chancellor walks in to attend this session and rightfully deserves this thundering standing ovation. As it shows the commitment of the man, the individual, and the institution for which Symbiosis stands, for the commitment to health and well-being. Thank you so much, sir, for gracing this occasion. And we will be giving certain opening remarks before I pass on the mic and the podium to the subsequent speakers. Well, we all need to understand that there's an inextricable linkage between health and academic success. And probably as academicians in diverse capacities in university settings or in higher educational settings, we need to understand a very important seminal concept which was propagated a couple of decades back called as the domino effect, which talks about one
Recording in progress.
aspect of students' life impinging and colliding and thereby impacting students' academic success and thereby academic success, performance, or failure, affecting in a way student retention, student attrition, and the ultimate attainment of the goals for which a student enrolls for higher education. Students, my friends, are erroneously assumed to be healthy. We assume that they are young and therefore they are healthy. But I need not substantiate this misconception about students being healthy by the various statistics which talk about the issues of substance abuse, relationship problems, the incidence of heart disease and other lifestyle related disorders which are creeping into this young generation at an alarming rate, to address the much touted demographic dividend which is getting fast converted, I'm afraid and shudder to think, into a demographic disaster. Therefore, there is a strong need for us to understand the importance of providing and addressing the issue of health and well being on campuses of educational institutes, on campuses of echelons of higher learning, and reorient our approach, our understanding to healthcare services from a curative paradigm to a preventive paradigm to a promotive paradigm. No longer does the world talk of morbidity and mortality, they talk of health and well being. That gets us to the concept of health. And in the three focus group discussions which we have had with eminent people from different walks of life over the last 2 days, new dimensions of health beyond the conventional, what the WHO mentioned way back in the 1980, a salutogenic approach and an important concept of health beyond the physical, mental, social, and spiritual dimension, and not merely the absence of disease or infirmity, comes or came across various dimensions of sleep health, dimensions of sexual health, dimensions of spiritual health beyond the conventional straitjacket approach of spiritual health, so on and so forth. And that got us or gets us to this important concept of health promotion, which again is erroneously equated to being similar or synonymous with health education. Ladies and gentlemen, health promotion, without getting into the details of discussions and the definition, is a multi-pronged approach where health creeps in into our daily aspects and spheres of life very innocuously, very subconsciously, but impacts the quality of life. And there are different strategies adopted by different organizations for health promotion amongst its stakeholders. In academia, the stakeholders are the students and the staff. But in organizations and in academia too, it should be the community at large, at least the adjoining community. And strategies of advocacy, where you advocate for the concept of health, enabling it to ensure an equitable distribution, making it accessible, making it affordable, making it available to the marginalized, access compromised populations, is something which we should look at. And finally, it has to be mediated. I strongly speak on various fora. Why should health or healthcare services be the sole fiefdom of healthcare professionals. It is as much an integral part and a responsibility and a right, a fundamental right of everyone to have access to healthcare, to be a participant in the delivery of healthcare mechanisms beyond the doctors, beyond the nurses, beyond the healthcare personnel, to include the economists, to include the IT professionals who devise soluble, viable healthcare solutions, to the economists who talk about the healthcare financing, and various other people who come from different professional dimensions, the lawyers, the legal professionals, so as to say, who ensure, finally, as everyone says, law is just nothing else but common sense applied to society. So they are equal stakeholders, and we need to understand that it has to be an integrated, combined, comprehensive, and a holistic approach, which we would like to be discussing in the sessions which will follow. There is therefore a critical role of higher educational institutions. What is the role? Is there a role? Yes. What is the role? What are the different roles? Why should a university or a higher educational institute participate in health promotion? Is it because it's a feel good factor? Is it because we owe it to society to churn out not only academically sound students but even healthy students? Is it that we owe it to our faculty, teaching and non teaching, to ensure their good health and well being, which will contribute to their productivity? Or subtly, does it contribute to rankings and accreditations and therefore the TRP, as they say in colloquial language, of the educational institutions? This is something which we are going to discuss by these eminent panelists. What have been their experiences? What have been the success stories? What have been the not so successful stories? What are the strategies they have adopted in combating and promoting health in their respective organizations? And what all worked and what all did not work? And finally, as the ACHA document says, are we looking at only this oft beaten, oft touted concept of ROI, return on investments? Is there today not a need to change from return of investments to ROAR, ROAR, return of allocated resources? Don't look at the penny which you invested, which has become a pound alone. That may be important. I do not deny that. But also understand the importance that the investment you have done in the health and well being of your stakeholders is going to reap rich dividends in years to come. So, with these opening remarks, I welcome the first speaker for today. Can we have Professor Stephen van den Broek, his profile being displayed? Professor Stephen Brock is coordinated and supervised a large number of national and international research projects in the area of health promotion, preventive behavior change, chronic disease lifestyle management, health inequalities, public health capacity building, and health literacy. He has served as an expert in the European Commission and the WHO and is an executive member of the IUHP. A member of many editorial boards of repute, he has but naturally contributed to several publications, including certain books. It's indeed our pleasure and privilege to listen to Professor Stephen van den Broek, who is going to join us virtually. All yours, Professor.
And so I am professor of public health psychology at the Université Catholique de Louvain, which was shown on the introductory slide. I think, as has been said in the introduction, I think universities really represent a fantastic opportunity to promote health and well-being. And we know that, as was said again, promoting health can be done through education, but not only through education. I think we have experienced that in health promotion, we can be more effective if we work through what we call a settings approach, an approach that goes beyond just using a place for education of the individuals that are part of a context, but that considers the place and the context itself as an important determinant of health and well-being, and a modifiable determinant as well. And so based on this approach, which has been applied in schools, in workplaces, in cities, the concept of health promoting universities has also been developed. Health promoting university is basically a university that takes care of the health of the people. And so we see that a number of action areas and also principles have been laid out and developed, and there's good guidelines available. And we see that throughout the world, there's quite a few universities that have tried to act on these principles and objectives of health promoting universities through the framework for action that was laid down in what is now called the Okanagan Charter, the latest set of guidelines for this approach. What we have seen is also that when we put these principles of health promoting universities into practice, that it, of course, depends on the way the initiatives are implemented. And especially for complex initiatives like settings-based approaches, it's important to find the right balance between following the guidelines with a high degree of fidelity, doing what is in the plan, but also adapting it. And we see that universities that have applied the health promoting universities initiatives sometimes meet and often meet with difficulties. And that can be related to the absence or the insufficiency of resources and manpower, but also more content-driven aspects, like, for example, not much value given to health promotion, lack of motivation of staff and students, also difficulties to look at what the situation for the starting point is, which makes it more difficult to see whether the intervention is successful or not. So we see that there's a number of difficulties that are really related to implementing this beautiful set of principles and actions. So one thing we can do is to say, okay, we need to work on this. And I think a way to work on this is to actually study the implementation of health promoting universities. Now, it strikes me, and it has struck others as well, that implementation of the health promoting university concept is not really well documented. There are several articles, there are books, there are guidelines, but the way in which the initiatives have been implemented is not always well described. So I think we need to investigate more and better how to implement, and that means to also look at what are potential barriers. We have to map them. We can also look at moderators, factors that affect the implementation of the health promoting university approach. And we know that there are models of implementation that we can use, but they're very seldom used to more understand what are the barriers, what are the moderators. And on top of that, I think we should also look at the way in which this can differ. We have different cultures, we have different settings, different societies. And I think it's important to be able to also look if the barriers, moderators are the same or different when we implement, for example, in India or in Europe or in Latin America. And maybe we can then be better equipped to adapt to the situation given. So this was the starting point for a series of studies that my team and I have undertaken. So we were looking at how universities across the world try to implement the action areas and the items of work of the Okanagan Charters. And we did this through an online questionnaire. We contacted a number of universities that are working on health promoting universities. We managed to get the collaboration of 54 universities from 25 countries, representing all continents and parts of the world. And when we look then at the implementation of actions, we see that across the board, there are certain action areas that are more often implemented and actually very well implemented. For example, the skills for health and well-being of students and staff, support for research are by and large undertaken by at least 2 out of 3 or sometimes 4 out of 5 universities involved. Others are much less given attention and actually only done by a minority of universities. For example, postgraduate training in health promotion is not often undertaken, reorienting the primary health care within the universities. And the same goes for the what we call in the Okanagan Charter, the items of work. We see that physical activity and sports or eating is very often addressed, but drugs abuse, smoking spaces or the creation of them is much less often the case. So we see that universities differ. In itself, that's not a problem. It can be a sign of adapting the intervention to specific situations. But I think it's important to realize that we are often working in different topics and with different accents. I think it's also interesting to look at different types, and we have within this part of research also try to create a typology. I'm not going to deal too much with the methodological details, but using cluster analysis, we have managed to identify certain groups of universities, and you have actually 4 types of implementation undertaken. You have what we could call emerging health promoting universities that are actually at the start of the process, very often not yet recognized by the authorities of the university. They're not really applying the whole system approach, and evaluation of the initiative is often not available. And then there's a number of established health promoting universities that are trying to put the principles into practice across the board. Some of them with funding from the university, some of them without. And sometimes also they belong to one of the many health promoting university networks that we find across the world, which often gives a support and recognition to these universities. So you could see that there are different types, and I think it might be wise to take that into consideration. Where are we in a given university, and what can we do about that? Now, if we look at what we can actually do, I think we should look at what are the factors that can help the development and implementation of health promoting universities. And for that, we had interviews with representatives of 17 universities, mostly, well, actually exclusively in Spanish-speaking countries, both in Latin America and in Spain. And so through qualitative analysis, we looked into the factors that could be either determinants of the implementation or moderating. And so when we map these various factors, we see that some of the factors are really key determinants of the possibility of implementing the health promoting university approach. For example, and they're the ones that are marked in red here. So the political support by the university authorities is key. Funding is important, coordination and having a unit that is taking care of it, but also participation and collaboration with others across or also outside the university. And then the context, the sustainability of the university authorities and the continuity, the value that's placed on health promotion, the visibility, the space and extension of the initiative, and community and visibility are factors that act more like moderators. So they can actually help the key factors, key determinants of the implementation to be put into place. So with these, I think we could safely conclude that health promoting interventions can be successful, but that of course depends on the way in which they are implemented. But despite that, we see that health promoting university concept and the way they are implemented is not really well documented in the literature. And that means that we can rely less on the experience that's been documented. We see that universities can differ with regard to the implementation of the action areas of the Okanagan Charter and the guidelines that are really available and really fruitful. And in terms of the factors that influence the implementation, we can see that it makes sense to make a difference between main factors like political support, like coordination, like collaboration, but also moderating factors that can indirectly impact on the implementation. I think it's important to further this research, to go on with research on the implementation, to learn from it. And I'm absolutely convinced that this will help us to facilitate and to improve the way in which the health promotion university concept is being implemented in practice. And with that, I would like to conclude this short presentation. Again, thanks for your attention for this. I will stop sharing my screen, and I'll be very happy to reply to any questions that will be posed in the debate and in the discussion, the panel discussion afterwards. Thank you so much.
Thank you, Professor Stephen. It was indeed very informative, where you outlined the role of settings-based approach for health promotion. And we'll come back to you with the questions for the panel in the second half. I now have the privilege of inviting Dr. Olga Maslova, who's a professor at the Northeastern University, Boston, USA, who is a neurosociologist focusing on the social capital involvement or impact of VR, virtual reality. Is that what I understand? Okay. In various contexts, including a biofeedback mechanism, her research interests lie in quality of life and social aspects of digital inclusion of people with motor and cognitive disabilities into VR rehabilitation technologies. So, from curative to preventive to promotive to prehab facilities. Lovely. And obviously, she's therefore been a PI in several international multicultural research settings, which has led her to be an integral part of Erasmus, the Fulbright program, and Medversity, BRICS, and many others. Co author of several patients' articles in peer reviewed, high rated journals, and reviewer of the Frontiers in Behavioral Neuroscience, which is indeed commendable. And ultimately, an international master trainer and educator in power plate, international master trainer and educator in disc training, and obviously, therefore, a much sought after speaker at various United Nations Perspective Series. Welcome, and all yours, Dr. Olga.
Good afternoon. I'm very happy to see you all. It is my pleasure to be part of the World Event G20 Summit and to speak today at the special Uni20 Conference in Pune. I was honored to be invited by the Symbiosis International University, which provides a valuable forum for scientists, for educators, and for policymakers to discuss the transformative role of the universities in promoting the health and well-being. The problem of empathy was mentioned by other speakers at the other sessions of our conferences when they was discussing the problem of collaborations and industry, academy, collaborations and partnerships. So promoting health and well-being works only if the empathy exists. What makes us connect with others and what makes us disconnect? The key to the human connection is empathy. Empathy is the ability to perceive and understand the feelings, thoughts, and emotions of other people. Recognizing this important ability is the first step to the achieving a better and healthy future. But now we are at the center of a global empathy crisis. So the study presented in Boston analyzes data of on empathy among 40,000 college students over the last 30 years. The study found the biggest drop in empathy after the year 2000. College students today are about 40% lower in empathy than their counterparts of 20 and 30 years ago. Another study examining the correlation between length of medical training and level of empathy found that self-reported empathy is lower in upper year medical students when compared to lower year students. So the conceptualization of empathy and empathy education in the large social groups has a global significance for building positive interactions between people in different fields required face-to-face, eyes-to-eyes communication, including the millions of medical workers and millions of patients. The human capacity to care is central to creating the type of social system that helps us to find creative solutions to pressing world issues. The way is running from empathy as understanding and empathy as feeling others to the empathy as an appropriate response. So the United Nations draws the attention of the world community to global issues such as health, education, disabilities, and others. The G20 summit discusses the global developments connected with the health crisis and access to vaccines, food safety, culture, climate change, and leadership. The fundamental base for solving these issues is empathy and activities to improve the people's lives around the world. The topic of India's G20 presidencies, one family, one future, affirms the value of life and well-being distinguished by a human-centric approach at its core. Empathy is the way to the well-being, and mutually, by feedback, well-being expands the empathy. There is no more powerful transformative force than education to build a better future for all, founded on equal rights and social justice, respect for cultural diversity and international solidarity, responsibility and empathy, all of which are fundamental aspects of our common humanity. And the transformative role of universities in promoting and developing of empathy for well-being and health is crucial for it. I would like to demonstrate some tools and practices we use in our work. We offer our experience and tools to build collaborative networks and partnerships in empathy and well-being. One of the main principles is belonging, the science of creating connection and bridging divide. Our experience in the forming this trend on the global integration of the universities in Europe, Africa, North and South America, Asia confirms this concept. We have several educational and scientific hubs with the world universities in education and research, the empathy for well-being and health. The first one is Erasmus Plus project funded by the European Union. It is about the lessons learned from the COVID pandemic. It is a teaching program designed to introduce and mainstream European Union methods in study programs in medical students in the European universities. There are several educational models in the context of empathy led by the international team of researchers and teachers. The second one is the Horizon project of the European Union. It is an educational and research program of virtual mobility for students, which is called Empathy for Leadership, Wellbeing and Innovation in the Uncertain World, in the VUCA world, for university students from Italy, Poland, and other European universities. Another project is a European Volunteer Services for students. We work together with our colleagues from the Great Britain. The next one is an educational and research project in empathy, leadership, and innovations for students from the universities of BRICS countries, Brazil, Russia, India, China, and South Africa. Another interesting project is a Fulbright program for students, faculty, and researchers from United States and other countries in providing lectures, workshops, and research projects in terms of empathy. And also we have the research hubs on empathy. The first one is the International Consortium of European Universities about the promotion of sociology and neuroscience in empathy. Together with our colleagues from Italy, Switzerland, Brazil, Russia. The next one is the Experimental Sociology Laboratory in Analyzing Empathy with the European universities. And the next one is the Research Center for Work, Health and Well-being at the Northeastern University in Boston. We work together with the Harvard Medical School. And the leading research hub is a Neurosociology Lab, which I organized at the Neurosciences Research Institute for the first time in the country. And the next tool we offer is a new trend, the metaversity system. Metaversity is the combination of words metaverse and university. This program integrates several universities in United States, offering immersive learning opportunities for students, faculty, and researchers from different spaces of the country and the world by virtual reality. Just as metaversity is transforming what we teach, it is also transforming how we teach. So metaversity is a new educational environment for building empathy and well-being. Metaversity users work in the digital labs, virtual educational spaces, communicate to each other, travel to the location around the globe. So metaversity system is a new global trend, and we offer this tool for education and global promotion, knowledge and skills and empathy, which allows to unite students, faculty, and researchers from different parts of the world on the common platform. The most actively used technology in education of empathy in metaversity space is virtual reality, which is described as an empathy machine, since it allows people to experience anything from another person's point of view. Education programs include using virtual reality to teach humanitarian empathy towards those with disabilities, with different skin color, with different economic goals, and from different age groups. In the virtual reality conditions, from the first-person perspective, the students and faculty feel what it would like to be a homeless or to live in the refugee tent or to have a disability. This is a great educational technology to train medical students for building empathy and developing their professional skills. For example, virtual patient simulation, disability simulation, interactive lectures, and role playing. Not only can a student be immersed in an environment where they can learn hands-on, but they have an avatar nearby, ready to have a conversation about the challenges they're facing. We focus on the social aspects, social emotional learning, metacognitive strategies, ways to increase health and well-being. It is in the line with the United Nations initiative, which is called People for 2030, aimed to build the empathy, well-being, and inclusive working culture free from all forms of discrimination, exploitation, or abuse. And another tool we offer to the global community of the university is a method of identification of empathy. First of all, I'm a neurosociologist. Together with a neuroscientist, we proved that there are special parts of human brain that are highly sensitive to empathy and determine the severity of empathy by their activity. In our neurosociology lab, we investigate the neural correlates of social brain in the tasks of empathy. Science and research allow to transform knowledge into innovations and future skills. Students take an active part in all these research projects. We know how to identify empathy. It is possible by the brain-to-brain dialogue in real environment, face-to-face, eyes-to-eyes, and in the virtual reality environment as well. We know how to make visualization. Where is my presentation? Please. And I would like to show you a short video. You can see the synchronization between two brains. So the straighter the line, the greater the interbrain synchronization between two or more subjects. This biometric method allows to identify and evaluate the empathy in leaders, in policymakers, medical workers, and in context of competition, leadership, inequality, solidarity, team dynamic, and other contexts in general for solving and prevention the world problems. Multi-brain synchrony method is implemented to metaverse, and multi-university integration makes it possible. In conclusion, I would like to say I'm convinced that empathy education can create social change in the world. All transformative platforms and tools in science and education I demonstrate here can be used for our partnership work in building empathy for health and well-being, together with the universities participants of the Uni20 conference. We are open for collaboration. Today is at the day of our conference. Is the World Humanist Day. Humanism evolved into an approach to life that prioritizes human well-being, health, happiness, and power of empathy. I believe empathy is a power that expands the world and gives us a chance for better communities, a better nation, and a better world. Everyone in this conference hall has the power to do this. This is the power of empathy. I'm convinced and grateful that the G20 summit and the Uni20 conference are being held very timely. It's time to draw attention of global community on the transformative role of the universities, to make global actions on the building empathy and well-being, to develop the inter-universities collaborations and partnerships in empathy and well-being by the common university platform, professional competencies, leadership, and innovations. Thank you.
Thanks, Volga. It is indeed nice to talk about empathy on World Humanist Day. So we were talking of International Day of Yoga, but you've rightly pointed out today is World Humanist Day also. Moving on to the next speaker, we've got Matt. Matt Dolph is the director of the Office of Wellbeing Strategy, the University of British Columbia, Vancouver, Canada. He's a doctorate in the field of sport and sustainability from the UBC School of Kinesiology and Master of Advanced Studies in Sports Administration and Technology at Lucerne, Switzerland, and a BA in Sports and Leisure Administration. Leisure Administration, ladies and gentlemen, please note there's something as a leisure administration also in the University of Victoria. So as you enter into a field of leisure here, you are being administered. which provides strategic direction for health and well-being promotion at the UBC and takes a systems-wide approach to supporting UBC well-being, the well-being at the University of British Columbia, which is a collaborative effort to make the university a better place to live in. So very important in the backdrop of specifically what Professor Olga mentioned, to not only live, work, play, but learn from community members as a part of a collaborative effort. His seminal contribution includes being a contributor to the development of the influential Okanagan Charter for Health Promoting Universities and Colleges, and he stands today as the champion, urging all institutions, higher educational institutions, universities to adopt the Okanagan Charter, and currently co-chairs both the Canadian International IUHP networks, and Matt has been on the focus between science and community-based work to promote human and ecological health and well-being. It is but natural that therefore he's contributed to a lot of research in the areas of sports management, environmental impact assessment, sustainability, and health promotion. Absolute pleasure and delight to welcome Matt to the podium.
Hello, namaste everybody. It's a real honor to be here in India, and thank you for the warm welcome and the opportunity to speak about this important topic. So I can start maybe while the slides come up. I have some slides. There it is. And that's the clicker. Okay. So the Health Promoting Universities movement, guided by the Okanagan Charter, and here's a copy of it that I always keep in my back pocket wherever I go, offers a paradigm-shifting framework to foster health and well-being through a whole of university and a settings-based approach. In the face of the global COVID-19 pandemic and renewed urgency to address issues like systemic racism, colonialism, and the climate emergency, we have an increasing imperative to act collectively and decisively. However, and we've heard this from Professor Van den Broeke earlier, mobilizing meaningful change across higher education institutions is complex. So we need to find ways to shift from an emphasis on treating illness, as Dr. Rajiv talked about earlier, or unwell-being, to the idea of a salutogenic and collaborative leadership approach to promote health and well-being in settings where people live, work, learn, and play. We also need to broaden our focus on the well-being of all campus community members, our places, and the species that inhabit the earth with us. My talk will share some learnings from the University of British Columbia, where I'm based in Vancouver, Canada, who's been leading this work for many years, and some of the other leading universities around the world. And I'll talk a little bit about the implementation side of bringing the Okanagan Charter to life. We've heard some of the theory already, and I'll talk about the implementation side. So the Okanagan Charter that you're seeing on the screen was created in 2015 at an international conference held on UBC's Okanagan campus. That's why it's called the Okanagan Charter. It's one of our 2 campuses. And we brought together 85 universities from around the World Health Organization, the Pan Am Health Organization, and UNESCO. We spent a year to develop this document, and it's based on the influential 1986 Ottawa Charter for Health Promotion, which includes the powerful statement that the healthy settings movement is about health being created and lived by people in the settings of their everyday life, as we've heard a few times already. One of the powers of the Charter is it gives us a common framework to work with, and it has 2 calls to action. 1, embed health and well-being into all aspects of our campus culture, across the administration, operations, and academic mandates. And 2, and this has come up a lot in this conference the last 2 days, lead health promotion action locally and globally. Next slide, or I can do that. Thank you. Starting in the mid-90s, the Health Promoting Universities movement has grown to become a strong network of activity across the globe. I need to color in the US as well. They now have a network. Europe, Asia, Latin-speaking countries have been doing this work for 20 years. And the international network offers a platform for the countries to collaborate. There are about 40 countries right now that have networks of health promoting universities. Next slide, please. So this is a glance of the University of British Columbia, our beautiful campus in Vancouver, campuses. Because I wanted you to understand our context. Design of this work is very important in terms of our unique context. We're on the west coast of Canada. We have 67,000 students. We're a large institution. We have 18,000 faculty and staff and 20,000 community members who live on the university lands. We have 500 buildings, and the Vancouver campus on the top right is on 1,000 acres of traditional, ancestral, and unceded territory of the Musqueam people, which means we stole their lands and are in a long process of reconciliation with the Musqueam people. The lower campus on the right is the Okanagan Charter, and that's on the unceded territory of the Okanagan Nation. So we operate at the scale of a small city. Next slide, please. UBC thinks broadly about well-being, and we have a strong commitment to people, places, and planet. We are the first campus in the world to sign the Okanagan Charter alongside 9 other campuses. We're also the first university in North America to commit to implementing the United Nations Declaration of the Rights of Indigenous Peoples, and that is a foundational document for us to guide how we bring an Indigenous perspective to everything that we do. We've been ranked #1 a number of times in the world on climate action by Times Higher Education. And that includes commitments such as 100% reduction in GHG emissions by 2035 and to fully divest from fossil fuels as soon as possible. We have about 900 researchers and 2,000 courses focusing on health, well-being, and sustainability. Next slide, please, actually. So UBC Wellbeing is what we call our collaborative effort to make the university a better place to live, work, and learn. And we take a whole systems and settings-based approach, as you've heard before, to doing this work. And I think in doing this, UBC is one of the leading institutions. Now that I see Symbiosis, I think we're in for a bit of a competition. But we've been doing this for many, many years, and I'm very impressed with everything that I've seen here. Next slide, please. We also have a long and deep history of embedding sustainability across our institution, going back decades. And our commitment is to simultaneously improve human and environmental well-being, not just reductions in damage or harm, so that by 2035, our regenerative focus on sustainability is embedded across our university in teaching, learning, research, and partnerships. Next slide. So I'm going to, for the rest of the talk about 6 paradigm shifts that I think are really important when we do this work. It is very challenging, and some of this comes from research that's been mentioned. There's a number of articles about this, but also some of the Indigenous knowledge holders in Canada that I've been privileged to learn from. So we have to not only look at some of the Western science, but think about some of the other sources of knowledge that can inform this work. So the first paradigm shift is a shift from self-care or individual behaviors to settings or determinants of health approach. Next slide, and I'll give a few examples. And this is, I think, a really effective way to frame it that a colleague of mine shared. If the frogs in a pond started behaving strangely, our first reaction would not be to punish them or even treat them. Instinctively, we'd wonder what was going on in the pond. So why do we not do that with people? Why do we focus on counselors and doctors? Next slide, please. The next paradigm shift is to shift from a pathogenic approach of needs, deficits, and problems to a salutogenic approach, which we've heard, of capacities, assets, and potentials. And I'll add a new framing, which is the regenerative approach, which is the idea that we need to restore human and ecological well-being together. Next slide, and I'll give you a few examples of this. So this is UBC's Thrive campaign. It's 12 years old, and the focus is creating a culture at UBC where we all value mental health and resilience is crucial to our capacity to flourish. So it's about positive mental health, not reductions in mental health. Too long, we frame these issues as problems and talk about things like substance abuse, mental illness, sedentary behavior. What would happen if we shifted it to a regenerative lens where we said promoting healthy substance use, promoting mental health, promoting physical activity? That completely changes the frame and the thinking about those issues. Next slide, please. Another example at UBC, and I don't hear this talked about enough, is the importance of built-in natural environments. UBC has one of the most ambitious commitments in the world with our Green Building Plan, that by 2035, that's not far away, all of our buildings need to make net positive contributions. So it's not doing less harm or being more energy efficient, it's actually giving back energy and being net positive in terms of biodiversity and other things. Health and well-being is one of the 8 priorities to guide the design of our buildings and our landscapes. Next slide. The next paradigm shift is to have a sole student focus to thinking about a whole of community focus, thinking about students, staff, faculty, and the community. You can't, if faculties are stressed, the students will feel it. We need to make sure that everybody is supported. And I'll give you an example of those on the next slide. So our strategic plan at UBC focuses on, at the center of the ring, a whole of community approach. And then the blue rings are embedding it in our university strategic plan. So it's centered in our mission to teach, learn, do research, and engage. And the outer ring, through deep community engagement and dialogue, was identifying priority areas for action, such as mental health, physical activity, built to natural environments. And these are shifting over time. Next, please. I'll share two quick examples that we just launched. This one we launched in January. It's called Supporting Mental Health in the Workplace, and it's a 30-minute required virtual mental health literacy training for UBC's 5,000 leaders. So anybody who has supervision responsibilities must take this training. We'll let you know how it goes as we evaluate the progress. And on the next slide, this is something we just launched last month, and I'd be very happy to share this with anybody. It's called the Activate Wellbeing Toolkit. It has a workplace wellbeing focus where we create a simple guide to bring to any unit or faculty to think about what are one or two things we can do in our space to implement well-being, but with the theory that we've been talking about. It's not just doing yoga classes, which those are fantastic. Thank you this morning, by the way, for a wonderful session. But thinking about systemic change. Okay, next slide. And one that is a great example of student collaboration is our SEEDS program. We work with 12 faculties and 250 courses to take a student, a staff, and a faculty member to work together on a project on our campus, what we call Campus Living Lab. So they work on a real life problem. We've had 2,000 of those projects already. And they work on a project for community benefit. Those bubbles are the 5 priorities areas at the moment. Well-being is one, accelerating climate action, biodiversity, great food transformation. But that's a great mechanism to get students engaged. Okay, just a few more slides. Next slide, please. The next paradigm shift is to go away from a top-down leadership model and a centralized management approach to collaborative leadership and community empowerment. So I love the African proverb that says, if you want to go fast, go alone. If you want to go far, go together. And that's what this is saying. Next slide, please. So at UBC, this is the constellation of partners that lead this work. There's not one office in charge of this work. There are student services, our human resources, our campus planners, our faculties, our student associations, our indigenous leadership teams. They work system-wide, and everybody has a stake to embed well-being in their own plans and policies and be accountable. And everybody comes together to advise and engage on different ways. So I don't use lines and boxes to represent accountability. We use this model. Next slide, please. Supporting that is what we call a backbone collective impact approach, where there are a number of committees, always with a student, staff, and faculty on them. Some units and some leadership teams that move things along and help identify priorities and areas of work. Next slide. So this is the last paradigm shift, which is, and we've heard this a lot the last few days, shifting our institutional mandates from the traditional teaching, learning, research focus to also having this public health SDG agenda focus and thinking about people, place, and planet in doing our work. So I'll just close with a final example. And the blueprints for how to do this are here. So one that we haven't talked about yet is the Geneva Charter for Wellbeing that the World Health Organization created in December. And that is, and I encourage everybody to read that document. Just wanted to find my note about it, which essentially underlines the urgency for creating sustainable well-being societies, committed to achieving equitable health now and for future generations without breaching ecological limits. I think that's a very important statement. The Okanagan Charter then translates those kinds of commitments into a higher education setting. So they work together, and we should update the charter to reflect the new Geneva Charter. Next slide, which is my last one. So 2 big ideas to close. One is think about universities as campuses, living labs. That's a very powerful way to frame these challenges. Test, try, learn innovative things on our incredible assets. In our case, 500 buildings, 80,000 people that can be engaged. All that brain power can be engaged in doing these innovative things, and then do it with community and share the results outside. So we have many programs tied to this idea of campus as a living lab. And secondly, be agents for change in broader society. From working with Indigenous people and a leading scholar at UBC, who's been researching trees for decades, Suzanne Simard, she's learned that trees are not equal in the forest, and the oldest and biggest specimens do far more to promote forest health than we know. So they have mycelium networks that talk to each other, provide nutrients, and support one another. And so I'm drawing a parallel to universities, where we are special places that can be that connective node with each other and between campuses. So I used a picture of a banyan tree for this one because I know that would resonate here. Otherwise, I would have shown you a great western cedar in Vancouver. So I hope that inspires you to take some action and to maybe think about implementing the Oaken Charter in your own context. Thanks for your time.
Last but not the least, my mate from Australia. And Anthony seems to be having a smile on his face, having seen the Palms beat England in the first test yesterday at Edgbaston. So he's all smiles. So Anthony is formerly the Associate Dean of Learning and Teaching and Head of the Professional Experiences in the Faculty of Health Sciences at the Australian Catholic University in Australia. He's been an integral driver of the ACU Future in Youth projects and health community initiatives, which has been successful in giving students authentic learning experiences and supporting the transfer of their learnings into real life situations, both locally as well as internationally. His primary research interests lie in skill acquisition and decision making, learning and performance, endurance training. An avid cyclist himself, he leads by example and is a fitness enthusiast and a health and weight loss consultant. He's been a recipient of many awards, including the Australian Awards for University Teaching, Citation Outstanding Contributions to Student Engagement, and a member of a team that received the Vice Chancellor's Award for Excellence in Student Experience.
Welcome, everyone, and it's a real honour and privilege to be here today. I must admit, I think I'd like to get a job at UBC. I think that's a fantastic presentation. I feel like everything from here is downhill, everyone, so my apologies. Look, it's always interesting. You come to events like this and you think, okay, I'm going to present something and people will think that's great. And I come here over the last 2 or 3 days, and like most times, I feel like I'm going to learn a lot more than I've been able to teach. And already what I've learned is so much about a student and staff experience and the context within your country, and how I can bring those contexts back into our country to better what we're doing already. So I feel like I've learned much more than I could possibly give. Thank you, Dr. Raj. I mean, this is a real privilege to be here today. What I would say is I'm from Australian Catholic University, and so as a typical Australian, rather than health promotion, I'm going to start with self-promotion. So as a university, we focus a lot in health and education. So nursing, teaching, allied health, sports science is my background. So we produce a lot of students that become nurses, teachers, etc. And I just wanted to put a bit of a context on where we're at right at the moment, both with staff, students, and industry. So at the moment in health, nursing, teaching in Australia, it is a crisis. It's a real, and we have to own this. We have to be really open and honest about this. The nursing industry with COVID and everything, it's really tough. People are not lasting in the industry. They're lasting 2 or 3 years max. They're getting fatigued, overwhelmed, and they're leaving. The same thing with education. Our teachers, we're setting them up to fail. We're saying, as a teacher, here you go, and you teach. The expectation of a teacher now, the demands are just out of control. We then go to higher education and we talk about faculty staff. And faculty staff are just being asked to do more and more and more the whole time. And then let's put a different question. Is 3 years ago, we were doing our thing and we were doing well, and suddenly this thing called the pandemic came. And we as universities and people in my roles and executives said, that's okay, we'll shift things to online. And we'll give you a whole week to do it. So that's plenty of time. You know, you've got a whole week to do it. And as academics, we do what we're asked to do. We always, you know, we want to do the right thing. So we worked really hard, and in the space of a week, we pulled our content online. It wasn't great, but we did our best, okay? And then that pandemic, which was going to last a little bit, has lasted 2-3 years. We've come out of it in some ways, but now is where the real pandemic is beginning. And it is because everyone is exhausted. Everyone is fatigued, right? And at the same point in time, we've been asked to do this and do that and do this because we need to make sure we keep our students, because it's an industry and we've got numbers and we're competitors, and it's really challenging. So we've got those two things. We've got industry and we've got academic staff. And then we've got our students. So if we provide a bit of a context for students, and especially in Australia, where I was in Melbourne, we're in isolation for the second longest out of anyone in the world. We watched a lot of television. And but we were allowed to do an hour of exercise a day. I did break those rules. I did more. So my apologies to my government. But it's really interesting that the students in that time were isolated. They didn't have that human connection. I saw it with my two children. It was so hard to see. And we see now the mental health issues that we're seeing with our students it's really hard to see. And then as academics, we're asked to fix that. We don't know what we're doing. We want to help and support them, but we haven't got the expertise. And having another 40 odd counsellors on campus, as Matt spoke about yesterday when we were speaking, is not the answer. All right, so we have to look at what it actually looks like into the future. Now, the students of today, and this is the data nationally, worldwide is telling us, they are going to have the highest amount of mental health issues than any generation that we've seen. They've incurred the greatest amount of digital disruption at an age where their brains in the time of development do not know how to cope with it. The amount of dopamine hits they're getting on a daily basis and looking for the next one, it is a drug and addiction that we don't know what the outcome is just yet. Their attention span has decreased, and then we're asked to cater for that. Make a video, put online. They don't read anymore, so you have to do this. So, you know, we're trying to cater for that as well. At the same point in time as well, what was fascinating on day one of the conference, or day zero, I should say, starting a conference with students was empowering. It was wonderful to see. And hearing the student voice, and I'm just going to read a couple of notes that I got from there and what students were asking, what they mean by a sense of belonging. And that's really important, that we don't define what a sense of belonging is, and we're not trying to get our students to connect to our university. That, unfortunately, that's not a sense of belonging at all. Okay, so the sense of belonging really comes down to being valued, being connected, being accepted, an area where we can have an exchange of cultures. So it's our job as a university to provide a setting for that to occur. And that's why a student might choose to come and stay at a university, not to tell them that you want to belong to us as a university and you can be an alumni and you can spread the word about how good we are as a university. That's actually not our job, all right? So I think it's really important to acknowledge that that's where people are at the moment. Thanks, sorry, next slide. So that was so again, just looking at us as a university as well, we have been successful thus far in really focusing on some key things. And so one of the things we really focus on is high quality teaching and graduate outcomes. So we make a promise to our students that if you come to our university, we actually prioritise learning and teaching. It's not something that we have to do and it disrupts our research. We'll find some time to do it. It's actually something that our staff are really passionate about. They love teaching. They come to our university to teach. That's what they want to do. And so they do that really well. We really focus, because we're health and education, we focus really well on graduate outcomes. We want students to be able to get a job, right? So I know they sound simple things, but from a student perspective, that's really simple as well. And we've got some really good data there to show what things we have been doing well. But we talk about student and staff health and wellbeing. I've just sort of said the issues that we're seeing. So at the moment, what we actually look at is, before we start with a solution, And I think all the work that Matt and Olga and others have presented today has some really good foundation of where we can provide those solutions. But what we need to do is something different than we've ever done before, because what we're presented with now is nothing we've ever seen before. So the foundation of being presented are fantastic. And as Australia, you can see we weren't on the map. We're behind. That's reality. So we need to, but still come to our country. It's okay. But we are a bit behind. So we need to be better in that space. So I see that as opportunity. So even from today, I'm going to go back to my university and present that work and say where we're at, because that's a great thing to see. So it's a great learning opportunity. But so what can we do? And so what I've done in the past, and next slide, please, sorry. What I've done in the past is, and we can go to the next one, sorry. Yep. Do you want me to do that? Okay, so this is what we've done to try to solve some of the student problems with students transitioning from high school in Australia to higher education. Because what we found is we looked at around 50,000 student comments, and they were telling us the issues that they're having in their first year of studies. And these are things we can fix, okay? These aren't sort of massive problems. These are things that we can just fix. So we did this, and this is a bit of a brainchild of mine I started about 18 months ago, which is to develop a consistent first year learning model across the whole university. So yes, people in the room, I'm that person that's telling academic staff how to do your job. So you can see, yeah, great. They'd be saying, yeah, thank you. That's great. Thanks for telling us how to do our job. But what I was seeing was different things that students, are consistent themes that the students are seeing. Now, there's a couple of things here that has changed since the pandemic. In Australia, we rely a lot more now on what we call our learning management system. So that's where a lot of the information from students, that's theirs, that's where they go to. So what we need to do is organise that learning management system in a consistent way that students could use less brain power trying to find things and just be able to find things easily so they can focus on their learning. Students also want flexibility. So we wanted to do the traditional flipped classroom where they do some master classes online before coming to campus, and rather than a traditional lecture that goes for 2 hours, that you can only come on campus at 8 o'clock to get that information. So not brand new, but new to have it across the whole theme. We've also got check-in surveys. So we ask students early on how things are going, and if things aren't going well, we respond. So students see that their voice is being heard, so they will engage more. They'll feel belonging because they'll feel like we're actually doing something that they're asking. So that's that bit there. And the other thing too is what we've done is easy access to our academic staff. So what I've also created is what I call blockout zones, where the rest of the university aren't allowed to come and annoy academics. That's their focus zone, so you've got time to focus on being with your students, because that's where you and the students need to be. So trying to not get the busy work happening as well. Now, just a couple of things around what I've done in the past as well to really help that health and well-being of staff and students. What we found is that one of the biggest learning things we can focus on is that transformative learning. So in order to have transformative learning, we really need to take ourselves out of our current safe space and move us somewhere where it's not comfortable. And that's where I think international students traveling from India to Australia or the UK or the US or other countries and back and forth, I think provide opportunities for transformative learning. So we did a lot of work in Timor-Leste. This is our local one, but we've also got international ones. So this is me a few years ago now when I was much younger, before I went into management and got the grey hairs. But this is in East Timor. So what we did is we had relationships in that country where that country asked us to come and help with students not coming to school, violence and bad nutrition, and they just wanted some help. So me and my background in sport, we use sport as a vehicle for sport for development. So I said, okay, we're going to go over there, we're going to work in your schools, work with your government, work with your communities to be able to provide how to teach physical activity classes in primary school. But as the previous speaker said today, we did it all in their language. So we got people to come and help write content, deliver content in their local language. And so we came and we had interpreters for us, so we understood, but everything was in the local language. We've ended up about 500 schools that we worked with in the community, and they all had their own manuals about how to teach PE in their class, which meant young children came to school. In Timor, when they came to school, the government gave the schools money, so they got fed. They got fed, they learnt. So again, the cycle, breaking the cycle of not having education. But what our students got to see was how to do that and how to look at health and wellbeing in a different context. So again, exchanging of ideas. The main thing I will say to this, both locally and internationally, is what I noticed so much is when we first came in, there was this perceived hierarchy where I would say, what do you think? And they would just say, yes. So whatever you tell us, we will do. And so it took time to build relationships. Once the relationships were trusted and they knew it wasn't just the circus coming to town for a year and we'll post it on Facebook, and they realised that we really wanted to be there, then we started to exchange ideas, and everything that happened was actually their idea. We stepped in the background and we just said, you tell us, we will support you, and they just thrived. There's that word again, thrive. So again, I think we've done that domestically. So what I've learnt from that to implement for our staff and our students is, in the next iteration, we need to give our academic staff and our students time for you to tell us what this next iteration of higher education is going to be. You have the answers, but you need the time and the headspace. So what I've developed as well across the university are two things. They're called staff and student professional learning communities. So by that, what I've done is actually highlighted time where we've blocked out time where staff can formalise informal time. And so what that means is on all of our campuses, at the one time, we come up with different themes. So no prizes for guessing. The first theme was AI, because everyone was stressed and worried. The second theme was assessment. The third one was communication. So they're different themes that our staff have asked us to do. So we've organised all that for them in formalised time, and then themes come ahead.
Sorry, that's not your presentation. That's a part of our university activities as a health promoting university, where we have pop-ups coming up every 2 hours.
I'm glad, because if it was my presentation, I was going to say, let's just stop there for a second. And I think the thing about that, now the other thing about the professional learning community is the student one. So giving the student a voice, and it's more than just here's a student on a committee. We see students on committees, they're not going to say that much like against what's happening because there's still this perceived hierarchy. So what I've organised within the university is a student-led professional learning community where they gather information across all of the campuses. They meet 4 times a year, and then they give information to our academic board on the themes of things that students think we need to change. And then we close the loop by circulating it back to them. So I think around the health and wellbeing focus, what I've really looked at today is slightly different than others. I've looked at the real current issues that we're seeing. What can we physically be doing in the space now as academic staff and industry? And how do we then internally encourage and empower the people that actually know what they're doing, yourselves and the students, rather than management telling people what they should be doing, because we just don't know. We're too disconnected. We have to rely on yourselves, but we need to coordinate that for you. And so what I'd say, that's worked really well, so much so that a lot of these initiatives have actually worked because staff have trusted in what we're supporting them to do, because we're doing the work for them. We're not just giving them advice and asking them to do things. So thanks again for your time today. Much appreciated. Look forward to the questions.
Thank you, sir. Before we move forward to the much-awaited Q&A session, I'd like to invite Provost of the Faculty of Medical and Health Sciences, Dr. Rajiv, to tell us a little more about the SIU model.
Well, friends, I would like to show what we are doing at Symbiosis International University as a health promoting university. And if you could have a couple of chairs more for Matt and Maslova to be seated here so that they can also view the video which we are going to show, which talks about different institutes and constituents of the Symbiosis International University towards promoting health and well-being amongst our stakeholders. So there are different departments and different initiatives undertaken by each of them. So the first one is about this.
Symbiosis Centre of Healthcare, SCHC, provides a comprehensive range of healthcare services, including preventive, promotive, and curative care to the Symbiosis community nationwide. In preventive healthcare, SCHC conducts comprehensive annual health checkups for all Symbiosis students and staff. It oversees campus hygiene and sanitation, food waste management, waste disposal, and the provision of safe water. Under promotive healthcare, the Health Education Program and Campus Wellness Advisory Committee encourages stakeholder engagement to assess and enhance existing healthcare services. Under curative health services, certified medical officers and nurses are available round the clock. To make healthcare affordable, every student and staff of Symbiosis is covered under a Mediclaim and road traffic accident group insurance policy. SCHC encourages stakeholders to participate in regular voluntary blood donation drives and providing medical aid to the Varkaris. The Department of Sports, Recreation and Wellness, DSRW, through its unique approach, places emphasis on promoting physical literacy, leading to a better quality of life and well-being for all its stakeholders. Going ahead, the department advocates, enables and mediates, striving towards developing smart, healthy and active campuses. To do so, DSRW provides access to diverse and innovative verticals with emphasis on mass participation and excellence. The sports and recreation facilities are state-of-the-art. Fitness testing is mandatory and intervention is provided wherever necessary. India's gift to the world, yoga, is offered by way of meditation and stress management programs. The 6 mass events conducted are live events, highly visual and inspiring. The participation ranges between 500 to 9,000. Innovative activities provide the change and challenge that everyone is looking for and include fitness dating, activity breaks, yoga pop-ups and 10,000 step challenge, to name a few. Mandatory credit programs have been initiated for undergraduates and flexi credit for postgraduate students, and highlight the primary goal of nurturing a healthy, fit, physically literate Symbiosis community. The rising prevalence of mental health challenges led to the establishment of the Symbiosis Center for Emotional Wellbeing, SCEW, in 2018. A team of qualified, accessible and collaborative mental health professionals and psychiatrists dedicated itself to creating a compassionate and thriving community by cultivating emotional resilience and wellness amongst individuals. With the aim to educate, destigmatize and demedicalize mental health, SCEW offers a variety of workshops, training, career counseling, early intervention screening and awareness programs related to emotional well-being. Some of these include workshops and activities on psychological first aid, emotional quotient or EQ, stress management, suicide prevention, World Happiness Day, and Mind-Body Wellness Day, amongst many others. The Centre's capacity building and outreach initiatives include the voluntary peer advocacy program called Mental Health Champions, telecounseling services, a child learning and development center, and collaborations with external institutes such as National Institute of Mental Health and Neurosciences for Y20. With the larger vision of incorporating education into mental health and mental health into education, SCEW also offers a mandatory 1-credit academic course on emotional well-being, as well as a 4-year undergraduate degree program, BSc in Mental Health. The Symbiosis University's mandate as a health-promoting university is practiced through many activities within the student life cycle, both at academic and co-curricular activities level. SSCA practices the sustainable farm-to-table food concept, where an organic garden is managed by its students, allows students to explore and learn the science and art of growing fruits, vegetables, flowers or ornamental plants using organic agriculture methods. The Ingredients Lounge gives insights into the modern concept of urban garden systems like soil-less hydroponic method of cultivation, using the latest technology, resulting in fresh, nutritious, and clean produce, free of chemical residue and pesticide. The Nutrition and Dietetics Department focuses on academic health promotion activities in the campus and community, research and policy development. The department focuses on enhancing nutrition literacy in university students and staff through varied approaches, keeping in mind Sustainable Development Goals or SDGs. NutriBuddies. The department has developed an innovative concept of NutriBuddies. They've organized regular food safety education for food handlers, street food vendors, and the community. They've also propagated the concept of Eat the Rainbow for Good Health, the development of nutritious snacks on the go, and millet promotion activities. The 900-bedded SUHRC provides top-quality clinical services free of cost to the neighbouring villages, talukas, Pune and Pimpri-Chinchwad Mahanagarpalikas and the community at large. Some of the facilities and services commissioned at the SUHRC are beyond the prescribed minimum standard requirements of the National Medical Commission. For example, 128 slice CT, 3 Tesla MRI, dialysis equipment, endoscopy, and cath lab unit, amongst others. Symbiosis International University has a strong Symbiosis community outreach program and extension, well known as SCOPE. The program was launched on the 2nd of July 2012 with the objective of impacting the community around the university campus. SCOPE endeavours to promote comprehensive and holistic development of the 35 access compromised and service deficient villages located in Mulshi Taluka. The activities of this centre include providing daily healthcare services, imparting health education to the vulnerable groups, and organising health activities for celebration of public health days through 2 mobile medical units. The efforts of SCOPE have created awareness about the hospital among these villages. In addition to these activities, specialist camps are conducted in the villages and needy patients are referred to SUHRC.
So that was a summary of the different departments and the different institutes working under the broad umbrella of Faculty of Medical and Health Sciences at the university. So I would just like to summarize what we have been doing. The first thing what we did was ensuring a commitment, and the commitment was by way of including it as a mission statement of the university. Mission statement number 3, besides promoting and developing world-class citizens with global competencies, etc., all of which are important from an academic standpoint of view, also talks about the university's commitment towards ensuring the health and well-being of its stakeholders, students and staff. We also ensured that faculty members worked on various governmental bodies as brand ambassadors of the Fit India movement. We also are bidding for the UNESCO chair for health promotion. So that shows our commitment and engagement with global bodies for the cause of health promotion. The second step which we did was get the pioneering advantage. When the concept of a healthcare center on campus was and is today still an alien concept, we took the lead way back on the 14th of June 1997 to establish the first ever healthcare unit on campus of an educational institute. Because every time educationists would say that the students are healthy, erroneously so, the staff have their own doctors and they don't need a healthcare unit on campus, because unfortunately students and staff access healthcare services only when their academic schedule allows them the flexibility and the time to go and reach out. Most often than not, it is always late. The third thing which we did with the difference was mediating through multi-stakeholder engagement. And as I said in the beginning, healthcare is not the domain of healthcare professionals alone. We need to have an interdisciplinary approach within the healthcare professionals also, as the Symbiosis Center for Emotional Well-being is not run only by psychiatrists, but it also includes psychologists, counselors, and an army of mental health professions, including the students, who help peer pressures being relieved and issues being better put across to the students. Because of the age difference in age not being too much, students accept their peers learning. We tried certain innovative approaches. First thing was ingraining it into the curriculum. So every of these initiatives which were mentioned, each one of them, whether it's the BSc in mental health, the credit programs mandatory for the undergraduates, or the flexi program for the PG fit for life, once you get it into the academic curriculum, so as to say, it gets into the DNA and therefore gets self-propagating. Second thing is, you have to speak the lingo of the students. We probably are on the wrong side of the age of the students, sitting on the wrong side of the table. But we have to talk lingo which is accessible and attractive to the students, whether it's farm to table, organic agricultural methods, urban garden systems, and eating the rainbow for good health are all examples where we try to reach out to the students. We launch initiatives which are student friendly. Unfortunately, during our times, there was no concept of fitness dating, which Naina has launched very recently. And fitness dating ensures or encourages students to go on fitness dates rather than on dinner dates. The concept of Nutri Buddies, which facilitates and promotes sound eating habits. We broke taboos. Mental health is still a taboo, like sexual health in India. And therefore, we thought, let's destigmatize it. And the tagline of the Symbiosis Center for Emotional Wellbeing is, let's talk. It's okay if you have depression. And it doesn't matter that if you go to a psychiatrist or a psychologist, you're not going to be labeled mad and insane. It's important that people have a venting mechanism by which they can share experiences, unfavorable or otherwise. And the second approach was demedicinalizing it, understanding again that there are people who can contribute in a team approach. We deployed technology, especially in the COVID pandemic, which we still continue to do. The objective is reaching the unreached, access compromised, service deficient, marginalized areas do not have access to healthcare. So telehealth, telemedicine, telecounseling services have been deployed. Collaborations have been one of the strong points of our healthcare initiatives, whether it's with the NIMANS or any other universities where we would like to share, and summits like these encourage a strong collaborative learning experience. We strongly promoted interdisciplinary translational research, by which we promote evidence-based research and a research-based evidence involving the students in the research. And those of you who attended the focus group discussions yesterday may have seen that the students of the MBA Hospital and Healthcare actively took part in the focus group discussions. And in summary, therefore, what has been the impact of all these initiatives which we've been doing for the last 20-25 years? Impact analysis of SIU as an HPU, whether it's the reduction in the incidence of diabetes, a better control of blood pressure, more students accessing healthcare facilities, more students accessing the health club facilities or the fitness facilities, more staff attending the annual health checkup, more students accessing mental health care services, so on and so forth, shows a significant continual improving trend. And that's where the proof of the pudding lies, in the sense that whatever you have been doing is assessed for its efficacy and impact. This is as far as the physical parameters of health are concerned, but also the wellness parameters, which the Department of Sports, Recreation and Wellness has put up in a beautiful slide. 203,058 staff and students participating in over 638 events, 15,000 testings being done, 500 plus recreational games, and 15 plus innovative events, all of which strive to promote the concept of a health promoting higher educational institute, of the stature of a university, of the stature of an international university, of the stature of Symbiosis International University. So that has been our story so far, and we've had a lot of learnings interacting with you panelists. So thank you everyone. Thank you Stephen, thank you Matt, thank you Olga, thank you Viti, everyone, and you have been a lovely audience. The panelists are always good, but the audience is always better. But unfortunately, we could not have the privilege of interacting with you. Have a great afternoon, enjoy your lunch, and each of these panelists are available at least till late evening today. Thank you so much, and sorry for overshooting the time. And the last part of this session is the felicitation of the panelists by the Honorable Chancellor, Professor Dr. Muzumdar sir. Can I request you? Or General Tutakne sir, our first Vice Chancellor, and the advisor to the Faculty of Medical and Health Sciences, if I could request you to felicitate. So the lady first, Professor Dr. Olga Maslova. Next, Matt Doff. Yes. Professor Anthony Vitti. And a virtual felicitation of Professor Dr. Stephen, because I believe it's an unearthly hour there right now. He's joined us in the early morning. So apologies, Stephen, for that. We will have it mailed to you.